KTEX-19 coming from the SUMA-2 trial, it has raised tremendous attention over the last 2 years. When Michael Wang for the first time presented the data at ASH 2019, it was really a rumor in the room when he could demonstrate that multiply relapsed mantle cell lymphoma patients benefited that intensively from a CAR T treatment. Overall response was more than 80%. And it was not only the overall response rate, but it was especially the duration of response, which even with further follow-up showed that there is roughly 1.5 year PFS now in these patients. And you have to keep in mind which population of patients was treated. It was patients with at least 3 prior lines, and they had to be refractory intolerant to BTK inhibitor. So that is kind of the core question today. What do we do with these patients? And in general, life expectancy of these patients is roughly 6 months. And so everybody was very impressed. But one of the key issues is that this is a single arm trial. So nobody really does know how this compares to another type of treatment. And so the SCHOLAR-2 was an approach to do that on a chart review basis. What we basically did is to identify patients with the same characteristics like those being enrolled in SUMA-2. That means refractory to a BTK inhibitor and not being treated with a CAR T cell like KTEX-19. And then the results of these patients in SUMA-2 were compared to these patients we identified from a real-world scenario. And so it was roughly 60 patients in both of these cohorts, and they were well balanced. Now, it's difficult to find these patients, so it was an international effort to do so. But indeed, so we had quite a good compared group of patients in each arm. And then there was a adjustment for statistic parameters. And then if you take it down after all these adjustments, which have been recommended by authorities, indeed, you can show that there is a dramatic difference in between overall survival for the SUMA-2 patients compared to standard of care patients. And as expected, overall survival for patients with standard of care was less than 1 year, whereas it has not been reached for patients in the SUMA-2 trial. So, I mean, this is not a phase 3 randomized trial, but it's difficult to do these trials these days. And so I think it's a helpful instrument to understand how substantial these data really are. And so with after scoring and propensity adjustments, I think this is as good as it can be at this time. And it's helpful to really understand the value of this approach. And to my understanding, it underlines that CAR T-cell treatment after BTK failure in mantle cell lymphoma patients is probably the most promising option we have today for our patients.